Welcome. Today we're here to discuss the future of healthcare administration to assist the company in recruiting and training the healthcare administration workforce necessary to meet the needs of 2025. Created in partnership with the University of Maryland, University College, Healthcare Administration 600 students, this presentation advises on the outlook of the future of healthcare administration in 2025. With an eye towards preparing the company to plan for the training and recruitment needs of the next few years. Increasing healthcare needs of the aging population, in combination with a preference by both consumers and payers for outpatient care and cost containment, will boost demand for healthcare administration jobs in long-term care, rehabilitation, customer experience, informatics, and philanthropy by 2025. Federal budget cuts and population pressure force healthcare facilities to change rapidly. Emerging job opportunities focus on the changing needs of the population, including the reality of older Americans living longer with disabilities and desiring to remain in their own homes. Moving away from the historical focus on institutional care in hospitals and nursing homes will place more healthcare administration jobs in community settings, focusing on long-term care and rehabilitation. The increasing need for long-term care services and support, rehabilitative services, patient-centered care, effective health informatics, and charitable funding will drive the need for long-term care administrators, rehabilitation administrators, patient experience officers, health informatics managers, and philanthropic professionals. Trends will dictate strong growth in certain healthcare administration jobs by 2025. Demographically, the aging population will live longer with greater impacts to their activities of daily living. This will drive growth in long-term care administration as the baby boomers seek care in their own homes and communities to preserve their existing lifestyle. Similarly, rehabilitation administrators will help supervise the care that returns the increasingly elderly population to self-sufficiency. Both long-term care and rehabilitation represent preferred choices for payers seeking more economical services to institutionalization. Demands for economy and mandates by states and the federal government will also drive the growth of chief experience officer and health informatics manager positions. With more payers tying payments to experience ratings, the role of the chief experience officer will grow. Similarly, payers demand higher quality care, which can be achieved through the use of health informatics, which are also the subject of federal mandates. Finally, as payments become less generous due to economization by payers, philanthropy may return to the role it once played in supporting healthcare organizations. Philanthropic professionals ensure that they act effectively in securing donations. This projection for Medicare spending reflects the aging of the baby boomer generation and their projected medical costs. It is also relevant to the Medicaid program, as it pays 53% of the costs associated with long-term care in the U.S. Long-term care administrators are expected to coordinate and supply auxiliary and medical support staff such as physical therapists and assistants, providers, occupational therapists, and other support staff whose work is required to keep residents healthy. Given the high cost of nursing facilities, administrators also spend a significant amount of time managing the population as they transition to lower levels of care. Entry qualifications range from a high school diploma and significant experience and on-the-job training for community and home-based administration to a bachelor's degree in a relevant field for most residential facilities. Many factors are driving the growth of long-term care administration. An aging population is living longer with disabilities. Payers find long-term care a more economic solution than institutionalization. Patients prefer to remain in their own homes. Technology enables them to do so, with greater ability to monitor chronic conditions and devices to assist with activities of daily living. Finally, state and federal policies require that care be delivered in the least restrictive, most home-like setting. Overall, we expect growth in long-term care administration to outpace the robust 17% growth for healthcare administration in general by 2025. So expect that as a subset of medical and health administrators, the growth in the field of healthcare administrators. They should grow by 17% between now and 2024, according to the Bureau of Labor Statistics. Supporting this is the Bureau's estimate that vocational rehabilitation specialists will increase by 9%, counselors and social workers by 12%, drug and alcohol counselors by 22% over the same period. Conversely, in a correctional context, the growth of correctional treatment specialists is likely to be below average at only 4%, indicating the same deinstitutionalization trend as in long-term care services and support. The Substance Abuse and Mental Health Services Administration estimates the number of substance abuse treatment centers to remain stable between 2006 and 2026, but a greater proportion of them to provide services for opioid dependence, including medication-assisted treatment. Similar factors drive rehabilitation administrators as long-term care administrator job growth. Entry in the field varies in a similar way, with a bachelor's degree being the most common credential. A master's degree is more common for complex facilities like rehabilitation hospitals. Officers was a response to tackling the growing number of customer complaints with their healthcare. Healthcare facilities were getting reviewed by their clients with modern applications like Yelp, Google Reviews, and others, as well as federal policies like HCAPs that create pay incentives for patient satisfaction. The first CXO position was at the Cleveland Clinic in 2007 and spread quickly to other institutions. A CXO is responsible for creating consistently positive, high-quality care experiences for both patients and staff. Their duties range from data-informed enterprise solutions at the strategic level to planning and implementation of those initiatives at the operational level to hands-on instruction of subordinate personnel in integrating enterprise-level initiatives that improve team communication and develop stronger relationships with patients. Provides financial incentives for patient experience at hospitals through their HCAPS process. The question topics on the survey are included here and demonstrate the need for a CXO to achieve good results on the survey and high patient satisfaction. Medicare payments and customer choice drove the development of the CXO position. Patient preferences play a large part in driving the demand. Providing reliable, positive experiences fortifies the economics of the institution by providing repeat clientele. Technology provides a role in pushing development as patients continue to see the provision of healthcare as a customer good in some respects. Hiring qualifications for a CXO include an MBA, MHA, or similar professional credential with substantial experience. Subordinate positions may require lesser qualifications. Increases in the use of health information technology are everywhere. Artificial intelligence, electronic healthcare records, disease management technology, cloud sorting, mobile applications, wearable technology, imaging, blockchain, and telemedicine are the fastest growing tools healthcare professionals can integrate into their organizations. Educational requirements to work as an health informatics manager must include a bachelor's degree, preferably in any informatics or information technology field. Additional coursework in medical terminology, medical administration, coding, and billing provides marketable skills. A firm understanding of ICD-10 is also encouraged for informatics managers. Further, applicants must be skilled at problem solving, understand technical orders, and persist in troubleshooting issues with their persistent analytical skills and a powerful desire to deliver results. The HITECH Act extended financial incentives to medical facilities to utilize electronic health records in 3 phases lasting 2 years each. Stage 3 will occur between 2017 and 2019, and once this period is over, medical facilities could face penalties for not implementing EHRs into their system, pushing HIT growth. Furthermore, development of third-party applications in the Apple and Google Play stores have pushed the need to integrate informatics in healthcare. An estimated 259,000 fitness and medical applications are available for customers to purchase. As with other professions, many factors will drive the growth of HIMSS. Government mandates push greater health information technology. Economics push HIMSS to facilitate the most efficient, effective care. Patients prefer to use technology to help them improve their health, and both consumer and industry-driven new technological innovations crop up every day. In 2025, philanthropy will play an integral role in generating funds for facilities. More facilities should develop philanthropic departments, creating more job opportunities for medical staff and executive leaders. Donations used to generate just a small percentage of revenue for any healthcare facility as federal payments became more prominent in the payer stream. Now, healthcare is facing a turbulent time as those reimbursements decline, and the current administration has proposed cuts in federal funding, requiring more emphasis on philanthropic efforts to meet the bottom line. As a result, philanthropic strategy has been refined. The culture towards philanthropy must change, and executive leadership must need to become more engaged. Tightening funding forces healthcare leaders to find alternative funding sources or revamp the existing ones to assure a sustainable future. In addition to developing a philanthropic program and changing the culture, mindset, and strategy of philanthropy, executive leaders must be heavily involved. One way to set that tone is to have a deeper understanding in the C-suite and creating a philanthropy position working directly alongside other executive leaders and reporting directly to the CEO. Philanthropy professionals often enter the field with a bachelor's degree in communications, public affairs, business administration, or similar fields. They may receive optional certification as a fundraising executive after years of experience. Two of the same forces driving growth of other healthcare administration influence the growth of philanthropy professionals. Those are economics in the form of lower payments from payers, requiring alternative financing, and government mandates, as Medicaid pays less than other payers and has expanded significantly in the payer mix. Thank you for allowing us to present here today. The largest macro trend driving growth in healthcare administration is the aging of the population. The baby boomer generation will live longer with greater disabilities, increasing the demand for care in their homes and to restore them to independence. These increased costs of care will empower payers to increase their insistence on high quality care and tight margins, pushing health informatics and development professionals. Both patients and staff will require management to consider their experience during their care. All of these trends will result in robust growth in the industry.